Hey everyone, welcome back to our anatomy series. In this video, we will be focusing on the humerus bone. Humerus bone is a long bone in the upper arm that connects the shoulder blade to the elbow joint. Let's dive right in and explore the different landmarks and features of this fascinating bone. Structure of the humerus bone. The humerus bone is divided into 3 parts. 1 proximal end, 2 shaft, 3 distal end. The proximal end of the humerus bone consists of the head, neck, and 2 tubercles, greater and lesser. The head is a hemispheroidal shape, with hyaline cartilage covering its smooth articular surface. In the anatomical position, the head faces in a medial, superior and posterior direction where it articulate the glenoid cavity of scapula. The anatomical neck is a slight narrowing below the articular surface of the head. The greater tubercle is a large bony projection on the lateral side of the humerus, located just below the head. The lesser tubercle is a smaller bony projection located on the anterior side of the humerus, just below the head. There is also a narrowing below the tubercles referred to as the surgical neck, which is a common fracture site. It is in close proximity to the axillary nerve and the posterior circumflex humeral artery. The shaft of the humerus bone is long and cylindrical, with several ridges and depressions for muscle attachments. The deltoid tuberosity is a roughened, V-shaped area located on the lateral side of the humerus, about midway down the shaft. The distal end of the humerus bone includes the lateral epicondyle, medial epicondyles, trochlea, capitulum. 1. The lateral epicondyle is a bony projection located on the lateral side of the distal end of the humerus. 2. The medial epicondyle is a bony projection located on the medial side of the distal end of the humerus. 3. The trochlea is a spool-shaped surface located on the medial side of the distal end of the humerus. It also articulates with the ulna to form the elbow joint. 4. Capitulum is a small, rounded surface located on the lateral side of the distal end of the humerus. It articulates with the head of the radius to form the elbow joint. Articulations of the humerus bone. The humerus bone articulates with 2 other bones, the scapula, shoulder blade, and the radius and ulna, forearm bones. At the proximal end, the humerus bone articulates with the scapula to form the shoulder joint, glenohumeral joint. At the distal end, the humerus bone articulates with the radius and ulna bones to form the elbow joint, humeroulnar and humero-radial joints. We have the radial and coronoid fossae, which are 2 depressions on the anterior side of the bone. These fossae accommodate the radial head and coronoid process of the ulna bone when the elbow is flexed. Finally, we have the olecranon fossa, which is a deep indentation on the posterior side of the distal humerus. This is where the olecranon process of the ulna bone fits when the arm is fully extended. Thank you for watching, and don't forget to subscribe to our channel for more educational videos.